can you get community pharmacists to make use of these QR codes too?
Yes, well, they could have access to the link. In terms of the QR codes, they were specifically developed for our organisation. However, should people be interested, they could contact myself and Yogi for further access of these QR codes.
And how can other people use the QR codes or access the videos?
The information and the videos are freely available on our website. And I hadn't mentioned actually that when I mentioned about the high-risk mental health medication, we have actually some films on clozapine and lithium. These were, as I mentioned, designed really for our population. However, if people did want to use that, they could sort of contact myself and Yogi to obtain those videos as well.
And a related question, how have you managed updating of the content?
The QR code stays static, so that doesn't change. However, the content behind that on our platform allows us to change that. So if we had to update it, and obviously, as I mentioned earlier, we do have a sort of governance risk process whereby we have to review the content and make sure that it's accurate at the time. So we can actually tweak the videos or reshoot the videos depending on the feedback we get. And that's why we've got this great facility so that when someone watches the video, they can actually put a thumbs up, a thumbs down. Did it help them to learn more about their medication? And so that gives us the process by which we can actually update the videos. For example, we did actually have some videos on the COVID vaccine, which was back in June. And actually, we had to put a caveat to say this was filmed in June, obviously, a lot of development since then. And so we do have a schedule to actually reshoot those videos as well.
And the next logical question is, could you use this approach with other medicines or other issues?
So we're looking at, because as I mentioned, that CNWL is a very diverse organisation. So some of the services we have include sexual health, and we do plan to do some videos very soon on PrEP. And that will be available for our patients when we administer that. And also for addiction patients, we are looking at opiate substitution therapy and preventing overdose. So one of our services is health and justice. We have a number of prisons, and we are looking to provide these videos for that population, especially on release when we know that they're at risk potentially of overdose. So there's some of the exciting opportunities that we are looking into at the moment.
Just for mental health, what we would like to do is also look at the over-prescribing and de-prescribing, because that's also very, very topical at the moment. So we're looking at trying to do that. But also the other area we're looking at is trying to provide people with tools to remain well when they're discharged from hospitals. So prevent readmissions, which is obviously very common in mental health. So that's another area that we're looking to explore as well.
And my last question, what would you both like to see happening now?
With this particular project, I would like this concept to be really adapted to, as I mentioned, to really be utilised wider. For example, the MHRA and pharma. And I think our uniqueness in this is that we're a co-production. So it's not just us as individuals and healthcare professionals providing this. I would like that to benefit wider, not just patients, but also carers and wider population, so that the awareness is via different means rather than reading information which may not always be as emotionally engaging.
Yogita, would you like to add anything to that?
Ultimately, what both Anshu and I want is to actually share this widely as possible. There's no point doing something locally and then not being able to share it across the health economy. So actually really do want to just share that. But the other area, which Anshu has also touched on, is just making sure that we use this for training purposes as well. So, linking in with higher education, or other, multi-professionals to make sure that people have a good checklist of what to do when they're counselling patients, particularly on these high-risk medicines. And the next thing that we're kind of looking at is how to make sure that whichever ethnicity, or whichever, if anybody's got any disabilities, so learning disabilities and people who possibly need Braille to access this information, that's another area that we're also looking at as well. So just not excluding anybody, really, to make sure that they have information at their fingertips.
The colleague that I mentioned that we worked in partnership with, Dr. James Ahinjashan, he also works for a company called QR Video Solutions. And that has enabled us, by signing up with them in partnership, to create this, because we have often been asked by other NHS trusts about how we've actually started this. And I think that was instrumental to making this happen.
Anshu Rayan, Yogita Dawda, thank you very much for sharing your insights with us today. That really has been inspiring. For more information about the work of Yogita Dawda and Anshu Rayan, please visit our website using the link in the description, and be sure to sign up for more news, videos and journals. For updates straight to your inbox, please follow the link below. And thanks for watching.